We're very rural, and we are not, of course, to the extent that St. Al's has their clinics. But I feel like we really put the personal touch on our patients. I was a nurse at the hospital for many years before I was the care coordinator, and I know a lot of my patients I knew before. But we also do things for the community. Yes, I do. I actually, we started a diabetes prevention program this year. I try to get anything going that I feel like will benefit my patients and help them to be more, to be able to follow their care plan and to be more compliant in their medical treatment. And so, we do, and we are striving for our PCM, our NCQA. We're just going through that right now. And so there are so many things that are new, but yet we do feel like we've done them for many years as far as, being patient-centered and following all those good initiatives that the state has put out. But I feel like our coordination program is a little more really personalized in that there's only me, right, with 2 clinics, and I take whoever is referred to me, and I work with. I meet them where they're at, and I go from there. And we do we do a lot of transitions too, and I do also try to keep up with everybody as far as where they've been, because we do a lot of sending out to other facilities that we cannot handle what they need at our facility. Care management, care coordination is, they are 2 separate things, but they definitely go together, and that's really what I do. I feel like I spend most of my day really communicating with the patients, and in education, I think takes the bulk of my time. Also creating care plans and making sure that the patient understands what their goals are, what we're working on, and that they understand what is, what they need to do to be healthier and to achieve the goals that they want to achieve. Like I say, I try to always meet my patient where they're at, and we work on things that they want to work on that are simple, that the doctor agrees with, and communicating with their providers is a big part too. And then, like I say, just working on things that they will help them be more compliant and help to educate them. So I feel like that is my role. It is always evolving completely. I've done it for 2 years, and it's probably changed tenfold over 2 years. But I feel like we've kind of gotten to a point now that I feel like I feel like I can really help my patients, and I feel like they are helping themselves too. So it's a good spot. We are connected to a hospital also, and we try to watch out for people who are using the emergency room as their primary care. And so we try to pick up on that and try to transition them into primary care so they're not using that. But we also check the census once a week. That's one of my jobs, is to check the census and make sure that none of my patients, or if they've been in there, that they are receiving a phone call and making sure that they get back to their primary care within 3 days. And we also have someone else checking just the regulars, for everyone else, and making sure that they are getting back in to see their appropriate doctor for their follow-up. And so that we just don't want people slipping through the cracks.
Right.
And so that's kind of, as far as transitions, yes. We are not part of IDHC yet, but we're looking forward to that. I think that will make life a lot easier. But we do have access to the surrounding hospitals, at least 2 that we can get medical records from. I do depend on my patients a lot to tell me what's going on, so I feel like I am, in contact with them enough that, or you hear through maybe their provider or something will show up in their chart that that something's going on. But that is a hard part of it. We do use Dulcion, which is an add-on to Athena, to track time and patients, and that does help my job quite a bit. So, but it is kind of hard to find things that are really valuable, worth the money to purchase that help. But that seems to be helping me anyway. I see myself as an extension of our providers that I work with, and like she said, it's the patients really do appreciate it. A lot of times, after a visit, I'll call to help them titrate a lot of blood pressure medicine, a lot of diabetes medication. So I'm calling them for a period of time, maybe every other day or every third day, and or just, after they've gotten a new medication and you call to see how it's going, and they'll say, it was $800. I can't afford that. I couldn't buy it. But they won't call back to tell you that. It'll just be another 6 months before they feel like they need to come to the doctor again, and then the doctor finds out that they didn't start the medication. So I feel like we're bridging that gap quite a bit, because then, I can help find ways that maybe we can get into a program where they can get the medication, or we look for another alternative if that's the case through the physician. So I just feel like it closes the loop, and the patients really are grateful. They really are hesitant sometimes to call, depending on the patient, and I feel like that's very important. And the doctors really do appreciate the follow-up, so that they know what's going on with the patient, and that they can, discuss with me how I feel about where I know the patient. They know the patient. I probably spend more time maybe with the patient because I call them more often, and you decide on a personality. You think, well, I think they would handle this. And they, it's a little more personalized. I think it is definitely a team. I mean, I feel like we really have a cohesive team where I work, but I feel like I work with everybody, and everybody works with everybody, but I feel like care coordination really is a super important part of that. In that I feel like the patient, and I have lots to do with even patients that are not my patients that are on my list that I call, that they know that somebody will be in touch with them, and they know that they can always call me and call the clinic and get an answer and get back to them in a good period of time, but I think it's very important to have the care coordinator as part of their transformation into patient-centeredness. So I started, and I didn't even know what a chronic care coordinator was, so I kind of felt like I was a little alone in this, and I had to do a lot of research and find out exactly what I was supposed to do. But I feel like I've got so many different opinions. I had some of our PCMH coaches telling me that I could have 250 patients, and then I soon realized that was unrealistic. And so I think it would have been really nice to have a mentor, and I try to do that for new chronic care coordinators on my end of the state. I have people call me every once in a while and just kind of ask me how I do things, because I kind of made it up as I went.
Yeah.
But I think you just need to learn to relax and put your patient first would be the takeaway. I mean, you still have to jump through Medicare hoops and hoops for your facility, of course, to make things work, but I think you just put them first and look at their needs, and things will go well.